When it comes to addressing the drugs crisis in Alberta, what policy the United Conservative Party and the New Democrats would implement has much to do with how the parties understand the concept of compassion for people addicted to drugs. The debate is perhaps best exemplified in the UCP's proposal to allow mandatory drug treatment. It's described as a policy that would allow for a family member, doctor, psychologist, or police officer to make a petition to a specially appointed non-criminal judge to issue a treatment order to someone who is in, quote, imminent danger to themselves or others. It would be a last resort, the party said in making the announcement on Monday. UCP leader Daniel Smith characterized the policy as actual compassion as compared to leaving someone on the streets.
We also have to be realistic that some people will never enter voluntary treatment without pressure because they will not be alive.
The NDP, on the other hand, has characterized such an idea as doomed to fail, both from a clinical and legal standpoint, and has suggested that the better route is to emphasize harm reduction services, treatment beds, abstinence, and other options. And this is hardly settled science, but it has been floated recently by British Columbia Premier David Eby and Gavin Newsom, California's Democratic governor, who introduced controversial care courts last fall, which run along the same lines. But should the UCP plan be adopted, it would be the first involuntary treatment law in the country specifically targeting addiction. It would raise various ethical and moral questions that aren't easy to answer. And though most argue the status quo is not a feasible option, not everyone is in agreement about whether or not such a policy would be effective or whether it would just introduce new challenges. Joel Dryden, CBC News, Calgary.